There's so much commercialization that's gone on with cannabis. I cannot walk down my block without seeing multiple like stores that people can access that. So what is that prevention infrastructure that policymakers should be thinking about when they're making different laws that allows people to sell in every block?
Research have shown that adolescents' exposure of cannabis use is usually through peer pressure. So this patient's treatment really needs to focus on motivation, engagement, and sometimes even family involvement. High rates of adolescents' cannabis use combined with the increased risk suggest a significant preventable public health burden. So adolescents who have increased experienced trauma, like physical or sexual abuse, are roughly 3 times more likely to report substance use. Legalization can lead to decreased perception of harm, as young people may mistakenly believe that legal equates to safe. It's legal, so it's safe. I can use this, or even as healthy. Pediatricians should screen all adolescents, usually from ages 11 years old and up, for cannabis use annually using validated, confidential, and non-judgmental tools. Besides abstinence, harm reduction is another goal. It focuses on reducing use, minimizing negative effects, decreasing relapse severity, and improving daily functioning. So over time, success with harm reduction can help some teens move towards abstinence. Now with what's going on in the world and budget cuts, right? So all the wonderful things that we have put together, they're all being cut. So we are going to see how this plays out in time. Our collective voice makes a big difference, and we need to continue to advocate not just for our patients, also our professions as well, because we are on the battlefields.
Hello, everyone, and welcome again to the Transform Minds. This is the podcast where we are exploring the real world intersection of addiction, mental health, and transformative care. If you're new here, just know with each episode, we're taking a thoughtful, practical, and evidence-informed look at how we can improve psychiatric and addiction care from the clinical settings to the community spaces we work in. So, as always, we do have our host RX, where it's just me and you. We're breaking down the literature and figuring out what we have to do for the work we do for the best outcomes possible. We also have our expert RX, where we bring in brilliant minds from the field, whether it's a clinician, physician, providers, scientists, researchers, advocates, policymakers. We bring all of them here and we discuss our current state, what changes we can make, and how we can be the best in our field. And we also have our Lift RX, where we're bringing in people who have lived through it, they have survived it, and because of that, they've become expert in the field and they're changing the field and systems because of their experiences. So today, it's my pleasure, and I'm so excited that you tuned in because we have an amazing guest, Dr. Vito, who is both a child and addiction trained and board certified psychiatrist. So if you're not happy to be here, I am happy to be here and I'm happy to learn. So I have Dr. Vito here. We're just going to give a clap if he wants to say anything before I introduce him proper to you.
Oh, wow. So thank you for that introduction. And yes, it's really my pleasure to be here. It definitely is a privilege talking to you and also to our audience here today. So, yes, I'm very excited as well to continue this conversation and this dear to my heart and most of my research that involves cannabis use in adolescents and how it affects them throughout young adulthood and eventually throughout their lives.
Absolutely. And thank you so much for being here. So, let me tell you a little bit more about Dr. Vito. He is a clinical assistant professor at the Grossman NYU School of Medicine and Langone Medical Center. Yay, NYU. This is our second guest from NYU, so we love them. In addition, he was a APA Gene Sperlow Congressional Fellow in Capitol Hill in DC. And what this is basically saying is Dr. Vito, for a very long time throughout his career, has been advocating for best outcomes, even on Capitol Hill in DC. He's there at the White House telling them what are the best policies for our healthcare system. So who is best to be here today to discuss this with us? He has also written numerous articles, given lectures on advocacy, especially on mental health topics. Dr. Vito has written chapters on topics of adolescence and substance use. So, to ground ourselves and get started today, I want us to frame our discussion. We're gonna look at 3 main data points. A 2019 meta-analysis in JAMA that found that adolescent cannabis use was associated with a 37%, hear me out, 37% increased risk of major depression in young adults. This same study also found that 50% increased odds for suicidal ideation among youth that are using cannabis. It also shows a 3-fold increased odds of suicide attempt. So, I know you've heard me say suicidal ideation and suicidal attempt, but there's a difference between that, and I will let Dr. Vito tell us a little bit more about these findings. The findings are from this longitudinal study, and it looked at over 23,000 individuals across 11 prospective cohort studies. We know when we look at the chain of research and studies that we do, meta-analysis is at the top of that chain, right? That means the evidence is so important and is some of the best that we have. So, Dr. Vito, please help us unpack what this literature is telling us.
Oh, yeah. So for this study, the meta-analysis, the importance of this meta-analysis, as you mentioned, they've done the 11 studies with 23,317 individuals and made a conclusion that adolescents' cannabis consumption increases the risk of developing depression and suicide behavior, but not anxiety later in life. So, in detail, the breakdown of what the researchers did: number one, they did a study selection, or in other words, is a systemic review. The team systemically searched for prospective longitudinal studies published from the database Inception to January 2017 that examined the relationship between cannabis use before age 18 and later mental health. And then they used data analysis or the meta-analysis. They calculated pooled odds ratio to determine the risk, finding, as you mentioned earlier, the 1.37 times higher risk for developing depression in young adulthood for those who use cannabis as adolescents compared to non-users. And they found a similar increase of suicidal ideation behavior. Importantly, the study found that there's no statistically significant association between adolescents' cannabis use and the development of anxiety disorder in young adulthood. Therefore, the conceptualizing results, the researchers highlighted that high rates of adolescents' cannabis use combined with the increased risk suggest a significant preventable public health burden, noting that the risk remain even when excluding pre-existing mental health conditions. And that's why this is so important. And thank you for bringing that up.
Of course, absolutely. Because right now, there's a lot of decriminalization of it, which is amazing. We love that people are not getting penalized for things that can be rehabilitated for. But we also are seeing a lot of people just using it freely without restrictions and not taking into account the implications and the consequences that may come, even at very young ages. And we know at that age, through adolescence, your brain is still developing, the frontal lobe is still developing, and that's where a lot of those decision-making capabilities are. And if we're like kind of messing with that becomes a problem. There's risk associated with it. We're not saying it's completely terrible, don't take it, all of that, because there are medicinal uses of all of these things, but just as there are benefits, there are also implications. So thank you for giving us that overview. Can you tell us a little bit about like the neurobiology, biochemical like implications of cannabis use, especially at a young age in adolescence?
Yeah, so with young adults, the importance about the neurodevelopment mechanism. The adolescent brain is undergoing significant changes, and some research suggests that while cannabis use may impact brain regions involved in motivation and reward, it does not necessarily manifest in higher rates of significance in other area of the brain. So there are consequences when the rewards and motivation are triggered. But the fact that adolescents, their brain are still developing, they might not have the mechanism for coping skills. And that becomes a real problem. For example, why are they using marijuana or cannabis, right? To help them be stress-free. And the problem with that is that then they don't know when they are actually in that phase, they don't know how to control themselves or how to monitor or how to behave in that factor, right? So that leads to more stressful environments, and therefore sometimes they end up being frustrated and can sometimes hurt themselves.
Absolutely. I can only imagine someone who has mood dysregulation but has very poor coping skills, no self-help seeking behaviors. Like that can really put you at a high risk. And we see that the study that you helped us break down, it shows like a 37% like increased risk. So for the people that are not researchers or in the clinical field and are listening, how should they kind of interpret what that means? What is the 37% risk?
Oh, I'm so glad you brought this up. Yes, the 37 rate of lifetime cannabis use among U.S. high school students as far as 2019 data is considered clinically significant and meaningful, especially the public health concern. This statistics combined with a rising product potency and earlier age of initiation is linked to detrimental long-term impact on the development adolescent's brain, as I had mentioned earlier. So there are four different factors. Number one, the brain development and cognition, as we know, adolescence is a critical period for brain development, and that regular cannabis use can alter the neurodevelopmental trajectories. Research shows that this association with impaired information processing, lower IQ, and decreased cognitive memory and attention capacity in adulthood. Number two, mental health disorder. Adolescents' cannabis use is associated with an increased risk of developing depression and suicidality in young adulthood. I also want to stress that it also doubles the risk of developing psychotic or bipolar disorder, which I've seen this many, many times with acute psychosis whenever I'm on call in emergency room, like last night. Number three, we also see this in academic and life outcomes. High frequency use is linked to higher risk of school absenteeism, lower academic grades, and higher dropout rates, and even lower university enrollment. Number four, this is significant because addiction potential. Adolescents who begin cannabis use even before age 15 are more likely to develop cannabis use disorder and addiction. And lastly, we have to keep in mind the higher potency. The clinical impact is exaggerated by the fact that the potency of cannabis, like THC concentration, has significantly increased over time from what we have seen 4% in 1995 to 14% in 2019. So this is very detrimental.
Yeah, absolutely. And when we look at the use, I know the most recent Monitoring the Future survey that came out, it showed that during the last years that they had looked at, substance use in adolescents were like going down for the first time ever. But the one thing that was new was like more kids were actually using THC, but the Delta 9 version of it, which has, like you're saying, there's higher potency, all these things there. And we were thinking, like, is there something else that's replacing this use? But then we also started thinking the possibility, like multiple factors, including it was during, shutdown, COVID, worldwide, kids were home. There were more supervision because parents were home. So that may have contributed to that. When you talk about all these risks that are associated, one of the things that you've mentioned earlier was also that anxiety was actually not associated with cannabis use. And as a trainee, when I think about cannabis use, I'm thinking, the person should feel some form of anxiety because it can bring paranoia, and paranoia underlying, and there's some anxiousness that comes with it. So what's this data telling us?
Yeah, you're absolutely correct. I mean, I see the anxiety all the time as a clinician, right? When I see patients, the anxiety is there. But in this study, they said anxiety was not significantly associated. And you might ask, why might that be? So while some studies show a link, evidence on whether anxiety directly causes or caused by adolescents' cannabis use is inconsistent, often showing weak or no significant association in longitudinal analysis. The relationship is very complex, with studies finding that cannabis use is more likely to predict future anxiety rather than the pre-existing anxiety driving use. There's also the bi-directional complexity, which means research suggests it is not always a direct cause and effect relationship. Instead, it's a dynamic interplay, quote unquote, whether the initial anxiety does not necessarily influence future cannabis consumption area. And also is that in some studies, when controlling for other substance use, such as alcohol, nicotine, and depression, the direct link between cannabis use and anxiety becomes less robust or statistically non-significant.
Yeah, absolutely. And I think that's what makes research so important, because we see things in clinical practice and we see how things affect people. But when we have research where confounders can be controlled for and all of that, we can actually then know what the evidence is saying, what the link is. Is this like a confirmed link? Is this just assumptions we're making based on one case that we saw? So it's really good to know that, there may be some link, but it's not really clinically or even like research wise, like significant. One thing that you've also mentioned through this is just, we're talking about suicidality. And this can absolutely be like a mini crash course for the people that are listening that don't necessarily understand the spectrum that comes with suicidality. So the study shows increased odds with just the ideation itself, but then they also mention attempts. So if you can quickly just teach us what that suicide spectrum is, starting from like the self-harm to the completion and what those differences are.
Yeah, and that is so important for our audience here is that number one, as clinicians, we need to recognize and acknowledge those and educate our patients, right? When patients come in and says, oh, you know what, I feel like hurting myself. And what would push from I think of hurting myself to I want to hurt myself. And then the action of actually having a systemic means to hurt themselves, such as weapons in the house. So all those things, how does a person go from one step to the next? What would push them? And so this is so important for us to recognize this, screening our patients, and including parents as well. Their radar should be high up there when their teens who are using substance use, such as cannabis, are saying these things. So this is important for us to be recognized and take this really seriously rather than, rather than say, oh, it's just going to be past. It's just a phase. That is not true. I think it's important for us to acknowledge that, to recognize that, and really have some action about it, such as even including discussions.
Absolutely. And I like the fact that you brought up it's not just a phase, which segues just perfectly into my next question of sometimes as family members, as, friends, we know the person and we're like, oh, they're just high. Oh, just that. But we're seeing that the study is also showing that regardless of, co-founders and all of that and controlling for that, there's still a multifactorial significant association between cannabis use and suicide attempts. So it's not just the thought, it's not just having the intention and the means. People are actually going through with it.
That's correct. And that's absolutely true. And then also recognizing what other factors that this person's going through. Yes, as the study has shown about the neurodevelopmental mechanisms, sometimes even trauma, the trauma that intersects with this can even push this into that next stage of hurting themselves.
Absolutely. And I've seen so many, like, just in the past 2 years doing like outpatient work, so many people that come in, and sometimes you may not even think of the trauma and how that plays a role. And it just reminds me of when you were talking about, different factors that were controlled for, different things that can happen, just the social determinants of, and the bidirectionality of that, of these factors can make someone use, but if someone also starts using at a younger age, it can also contribute to education level, income, all of these things. So the trauma of it is one of those factors that can make someone start using, but it can also worsen someone that already was using, right? So it's like it plays a huge role in that. So as clinicians, how can we offer like trauma informed care to children and their family members? Because I know when you in your field, you deal a lot with the parents as well, and the guardians is not
Oh, yeah.
patient.
And I'm so glad you brought up regarding the trauma and intersecting with this. So thank you, because this is a very important factor. Trauma is a critical intersection in understanding complex, often non-linear relationship between anxiety and cannabis use in adolescents. So research indicates that childhood trauma is a significant independent risk factor for both early onset cannabis use and the development of anxiety disorder, right? So adolescents who have increased experience trauma, like physical or sexual abuse, are roughly 3 times more likely to report substance use. There's this self-medication hypothesis. Adolescents often use cannabis to self-medicate, attempting to alleviate emotional pain, anxiety, or symptoms of post-traumatic stress disorder called PTSD resulting from trauma. And then there's the masking effect because traumatized teens may use cannabis to cope with or numb the underlying anxiety. The direct association between anxiety levels and cannabis use may appear weak or non-consistent in studies that do not account for the history of trauma. So that is an important issue as well.
Yeah, absolutely. And I mean, it makes so much logical sense for a child that has gone through like physical abuse, sexual abuse to want to self-medicate. One, because they don't trust the adults in their life because they may feel, I wasn't protected enough, this happened, or it could just come from a sense of anxiety and fear, like you mentioned. So definitely, I see how all of this can affect the child, make them use more, or even put them into using if they weren't using to begin with. The other thing that also comes up is just, and I think in the beginning we had alluded to just the decriminalization and different policies that can affect this. And as someone that has a strong history and knowledge in policies, what are some current policies that are sort of made cannabis use in adolescents more complex? For instance, the legalization of it. If you could talk a little bit more about that to us.
Yeah, so that's a very, very good topic regarding legalization of marijuana. Nowadays, cannabis legalization policies, we should really notify or let our elected legislators know the consequences of this, right? And I think cannabis legalization policies should incorporate age targeted preventing messaging. Research indicates that such messaging is crucial for protecting young people from the potential risk associated with increased cannabis access and potency. So, number one, protecting developing brains, right? We need to notify our legislators that evidence indicates that adolescent cannabis use is linked to long-term impairments in cognition and increased risk of psychiatric disorder, psychosis, bipolar, or even depression, as the studies have shown. Then there's also that correcting misperception. Legalization can lead to decreased perception of harm, as young people may mistakenly believe that legal equates to safe. It's legal, so it's safe. I can use this, or even as healthy. So targeting messaging is needed to counteract these views. Surprisingly, some of my patients who are teens and their parents think that cannabis is safe. Scary, right? So the parents themselves think that it is safe to smoke cannabis. Number three, addressing the high potency. Modern high potency cannabis products pose a greater risk of younger users, necessitating a specialized education to inform them of these dangers. These are not your typical grandmother's marijuana anymore. Today's potency are much, much higher. And then lastly, combining exposure to marketing. Adolescents are often exposed to pro cannabis, connected on social media, right? We've seen teens on social media and they see, oh, it's so cool to be smoking marijuana, right? So social media is a big factor there, which is associated with increased cannabis use. Targeted, credible preventive campaign as needed to counter this exposure. I think I also want to bring up that regarding Colorado, Colorado has this quote unquote good to know campaign. We know that cannabis is legalized in Colorado. And a lot of my colleagues who works in the university's mental health clinic, they saw an increase, a spike of cannabis use in college when it was legalized among students when cannabis was initially legalized. After the initial challenges, the Colorado implemented a targeted quote unquote good to know campaign, which successfully improved public understanding of the health effects of cannabis and the new legalization in Colorado.
Absolutely. And I think it's so when people or just generally legalization is equated with safe, it's okay, you can use it. And I always tell people when I'm talking about like side effects things, I love to use the analogy of think about everything in life that you use has the good and has the bad. Even drinking water, because drinking water is good for you. We ask you to drink water all the time. But what happens when you drink too little water? Dehydration. You may pass out. You may end up in an emergency room if you drink too much of it. Like water toxicity, but you're like, my body is mostly made out of water. So how is that toxic to my body? But it's just the same for everything. So yes, cannabis, it's legal, but it doesn't necessarily mean it's safe and I can use. And also using, like you said, the dose of it, when you're talking about just the dosing, the potency, I'm also thinking about just adulteration in general. You may think you're getting one thing, and you never know what else is in there. And we've seen this time and time again that's happened. Alcohol, nicotine, all of these are out there, right? They're legal, people use them, but there's also messaging that comes with it. Like when you buy a pack of cigarettes, there's a messaging that comes on there. When you buy alcohol, when it's advertised, there's always messaging that comes out of it telling you don't drink to drive, don't do this. So how come we can't do the same for cannabis, right? So absolutely.
And it's so scary. The other thing that we need to be aware of as clinicians is that a lot of the teens, they just don't use cannabis. They sometimes use it with something else. As you mentioned, I'm seeing a trend, scary trend, is that marijuana, they laced it with formaldehyde. Now, as we know, formaldehyde, remember our anatomy days? This is for the cadavers. Now, I was like asking one of my patients, like, why would you lace marijuana with formaldehyde? It's just because it keeps the high longer. And the problem is like sometimes they don't even know what they're taking or what their peers give to them. As we know in adolescence, their number one exposure of substances is through peer pressure. And we know it's just not just one substance. Sometimes marijuana in combined with alcohol, marijuana could in combined with something else. So those are the factors that we really need to be aware of. At the same time, our parents and even policymakers when they make this regulations.
Yeah, absolutely. And as you're thinking about that, you're thinking about parents, I'm thinking about there's not enough people like you out there who are trained in and adolescent psychiatry and addiction, right? So we have to use the resources we have. And most of the time, their first point of contact is going to be a pediatrician. And the landscape of use and risk is changing rapidly. Every day there's a new thing. They're lacing new things, new combinations. So how should a pediatrician be well equipped to screen? What are some of the things they should be screening for and how?
Yeah, so pediatricians are my colleagues. I'm always getting calls for consultation with a pediatrician, and for me, it's so exciting to be doing some collaboration with pediatrician. So pediatricians should screen all adolescents, usually from ages 11 years old and up, for cannabis use annually using validated, confidential, and non-judgmental tools like the CRAFFT, CRAFFT, which is a 6-item questionnaire designed to identify high risk alcohol and drug use. Or they had this tool to be one, which is screening for brief intervention, or BSTAD, which is a brief screener for tobacco, alcohol, and drugs. The screening should be conducted privately, focusing on frequency and motivation for use. For example, teens said, "Oh, I might say I use cannabis to help me sleep," to guide pediatrician for brief intervention. By the way, again, this is recommended by the American Academy of Pediatrician. What's important here when pediatricians do the screening, they have to do a couple points. They have to do this a confidentiality. Explicitly discuss confidentiality rules with the adolescents and parents separately. Explaining the limits about confidentiality, for example, the risk of harm to self or others. The second thing is approach. It's so important to have a non-judgmental, open-ended, and conversational tone rather than an interrogation style. It is also important to, once you have the screening, it's also the most important thing is like, okay, I did my screening, then I'm done. No. It goes on to follow up and intervention if the screen is positive. So, brief intervention, if a screening is positive, apply the motivational interviewing to help the adolescents identify their own reasons for changing behaviors like sports, money, family, school, and education. Inform the adolescents about the risk of cannabis on the developing brain. And lastly, referrals. Refer to behavioral health specialists or substance use disorder treatment programs.
Absolutely. And in all the things that you've said, amazing, amazing information. I'm hearing some of these screeners and tools, and I'm like, I need to go look more into it. Because most of what I'm doing is adults. I'm not really seeing kids. So I'm not looking at these screeners, but I'm like, in a few months, I'm gonna be in an emergency room somewhere or a hospital somewhere seeing all age groups. So I need to update myself and learn. So for the trainers out there, I'm going to highlight all these screeners in the notes so you can look them up too. And possibly we could put together like a mini sheet of the screeners that you can use, and it could be helpful for you as well.
So easy. I mean, this screeners it's not even 5 minutes. I think the most important here is to have that conversation, right? To open that conversation and let the adolescents start thinking, huh? Because sometimes they're not even aware that their substance use is increasingly used, the tolerance level is going up, and not even that, or even a denial, right? So I guess the important thing here is really take the time to have that screening, start that conversation, and really have it in the environment where it's really non-judgmental.
Absolutely. So what I'm hearing is start a conversation. Make sure it's non-judgmental, and you never know what you've sparked in the brain of the youth that you are treating.
Yeah, it's important to engage them. It's important to engage them. And you said these are scientifically based tools, and research have shown that it works. And you just never know how much lives you could save. And it takes less than 5 minutes. It's not that long.
Absolutely. I can't count more than a handful of when I was in CPAPs the past 2 years of how many kids would come in there and they smoke something. And now they're like, oh, I feel paranoid. I'm hearing voices. I feel anxious. I can't sit still. So, and it can trigger something. You can save them a lifetime of mental health disorders, psychosis, and all those things that comes with it. I have a case for us to discuss. It's a 16-year-old who began using cannabis every week. By the age of 18, his use has increased to daily use, and at 22, she's presented with recurrent major depressive episodes and a history of suicide attempts around age 20. From a clinical and systemic lens, how can we conceptualize this case and what has happened or what's happening?
So, unfortunately, working in this health field, including the medical, even the emergency room, this case is not unusual. I think recognizing and acknowledging cannabis use disorder early on is very important. Research have shown that adolescents' exposure of cannabis use is usually through peer pressure. So this patient's treatment really needs to focus on motivation, engagement, and sometimes even family involvement. So the teaching problem-solving skills, social skills, and relapse prevention is key, along with supporting function and ensuring proper follow-up. Aftercare is also essential, right? Those who attend aftercare program or self-support group tends to have a better outcome and higher rates of abstinence. So it's important to balance ideal goals with what's realistic. So abstinence is often the primary goal for adolescents, like do not take cannabis, marijuana, no drugs at all. And young adults, right, it's always not always achievable right away. Especially when you tell kids, don't do that. What do you think they do? They do it. They do the opposite, right? Many teens show meaningful improvement by reducing their use and improving functioning, even if they don't maintain full abstinence. So my message here is like harm reduction is another important goal. Besides abstinence, harm reduction is another goal. It focuses on reducing use, minimizing negative effects, decreasing relapse severity, and improving daily functioning. So over time, success with harm reduction can help some teens move towards abstinence. Regarding your second question about systemic lens, access to care is one of the biggest challenges. According to the National Survey on Drug Use and Health, only about 6% of adolescents who need substance use treatment actually receive it. Again, I want to repeat this for our listeners that only 6% actually receive substance use treatment. Most who do get access to care centers is through the juvenile justice system. You mentioned this earlier, and this is even more common among Blacks and Latinos youth. Therefore, this case, even though unusual, it's not unusual, it is a big problem.
Absolutely. And I love how you've highlighted the disparities because I am a big advocate when it comes to access, bridging those gaps, and just trying to close those disparity gaps that are there. So, one of our first episodes that went out, it was during Black History Month. So, it was very much so focused on just substance use addiction, the criminal justice system, and we had the amazing Dr. Barrett, who is forensic and addiction trained, come and kind of talk to us about the different lenses that you can take things from. And I learned so many different things from that episode. So I love when I get to talk to people like you who are doing the work. They have the knowledge, they have the skills, and they can teach us some of the things that we can do. It's so sad when you think about only 6% of
Yeah,
there's 94% of kids that need care and they're not getting it.
that's correct. And this is where advocacy is also important, right? Access to care, as I had mentioned earlier. And now with what's going on in the world and budget cuts, right? So all the wonderful things that we have put together, they're all being cut. So we are going to see how this plays out in time. And unfortunately, it's through the justice system. And that's not the way we want our adolescents. This is not the way for them to grow and to a young adulthood.
Absolutely. They're the future. Like they're going to take over. And if they're all in the justice system, I don't know who else is going to be taking over. And I think as a nation, we have to do better. But it makes me hopeful, especially in the last few weeks when there are all those cuts, just see how as a community, as a health care community, as a mental health community, how we all came together, mobilized. Because I want multiple listservs, and I'm just seeing the emails. I'm getting email after email. Call your representative. Do this. Just all of us coming together to make sure that there's some restoration. There's a lot of uncertainties right now, but as a community, it makes me so hopeful. I'm honored to be a part of a group of people that are, striving for the best and want the best for the people that they're caring for.
Yeah, and you're absolutely correct. This is where advocacy is so important, even for trainees. I mean, I was a trainee when I got that fellowship in Capitol Hill. I was working with legislators, and I learned that our voice makes a difference. Sometimes we're all frustrated. Oh, I'm just a student. Oh, I'm just an attending. No one's going to listen to me. That's not true. Our collective voice makes a big difference. And we need to continue to advocate not just for our patients, also our professions as well. Because we are on the battlefields and, we see what is going on, and our policymakers does not understand what is going on out there.
Absolutely. And as a trainee, this is my voice. Like this podcast, doing
Exactly.
this, it's literally part of my voice. When I thought,
Exactly.
what are some of the ways that I could bring awareness, educate, and have people hear what's going on from a different perspective? I was like, this is one of those things that I can do. And I am so appreciative that on a Saturday after a night shift, Dr. Vito is like, I'm not gonna go to sleep. I'm gonna come and I'm gonna be a part of this. So thank you for your advocacy. Since part of that.
This is where my passion comes in, not just educating others, but talking to colleagues like with you, how important our work is, and it's never over. We just have to keep going, and with lots of caffeine, it really this is where my passion kicks in. So
Absolutely. For those that don't drink caffeine, that is absolutely okay. People are always like, how do you do 24-hour shifts with no coffee? And I'm like, it makes me sick when I drink them, but I have found matcha and it works. It's a work.
there you go.
There you
And
go.
studies have shown at least 2 cups of coffee a day, helps your cognition. So there you go.
There you go. Hey, there you go. It helps. It helps. So looking at our case and bringing it back to just trainees like myself or colleagues, clinicians, providers, how does first age of cannabis exposure actually alter risk stratification?
So this is a very good question. So earlier age of first cannabis exposure, significant risk for adverse outcome with initiation before age 15, acting as a critical risk marker for faster development of cannabis use disorder. Now, 2 to 5 times higher risk of dependence and greater and often persistent cognitive and neurostructural deficits compared to later age. So, the key risk stratification changes by age of onset. So, less than 15 years, which is early onset, this is the highest risk group associated with twice as many mistakes on executive function tests and increased risk of early onset psychosis. The key drivers of the increased risk, the number one is neurodevelopmental sensitivity. Early exposure interacts with critical, rapid brain development, particularly in the prefrontal cortex, leading to structural changes and functional deficit. Number two, disease progression. Early initiation acts as a predictor for earlier onset, again, of psychosis. Lastly, addiction velocity. What I mean by that is that younger users transition faster from first use to daily use or dependence. So, and those are the reasons why.
No, absolutely. And, as trainees, when we see these cases, I think it's always good to have this knowledge at the back that helps us like navigate what we're doing. Because you have to, when you see whether it's in the emergency room, outpatient, wherever you are, you always have to do a risk assessment and having that knowledge based of at this age, these things are affected. The person that's using earlier on before 15 is more likely to have early onset psychosis. Oh, they may have said they were using daily last week, but it's week 2. And because they're younger, they're more likely to have already, exponentiated into like a week daily use from, and even multiple a day that they're using and how that can affect them. So having that, I think it's really, really important to know when you're assessing for risk when people come in and what that can mean. When we talked about like policymakers, advocates, and all of that, we mentioned so many different ways and factors that they can be helpful. One of the things that you talked about, especially even in Colorado, with the programming that they did, and I think it was the Good to Know project that they had, when we're doing these things, like there's so much commercialization that's gone on with cannabis. I cannot walk down my block without seeing multiple like stores that people can access that. So what is that prevention infrastructure that policymakers should be thinking about when they're making different laws that allows people to sell in every block?
So, in terms of infrastructure, right, regarding accompanying commercialization, right, to mitigate the risk associated with cannabis commercialization in adolescents, a robust, comprehensive preventive infrastructure is essential. So, what I mean by that, the key component include strict, enforced retail regulation, like adults only, no advertising near school, high compliance ID checks, evidence-based, school-based, and community prevention education, and targeted youth-focused public education and media campaign. So the initial prevention infrastructure components, such as regulation, environmental strategy, strict access control, like implementing, monitoring, and enforcing minimum age requirement, for example, 21 plus age for purchasing, retail restrictions, limiting the density of cannabis retailer near schools. As you mentioned earlier, unfortunately, I've seen many, many times it's just a block or two or even 3 blocks away from school. The parks, youth-friendly areas to reduce environmental exposure. Also, packaging and marketing control. Oh, it's so cute. And that's how they do it, right? They put like pink, colorful, and they even have cartoons. So, the packaging marketing controls requiring plain, child resistant packaging and prohibiting advertising designed to appeal to minors. Social marketing restriction, regulating marketing on social media and digital platform to reduce youth exposure. So those are the most factors. Those are the most important things. Is start.
No, those hit home because I'm like, when I think about candy flavored things they have, a lot of the packaging in the market, and it's really targeted kids. Because I'm like, I don't know which adult cares about a pink package.
Cartoons, right? Are these so cute and
They're strategically targeted population that they feel like is then going to stick with them for many, many years and purchasing that same thing. Definitely those restrictions are important. And there's some of them I didn't even think about. Like when I'm like thinking about how many blocks, I'm like, yeah, why is it near a school?
Or
Why is
park.
it near a park? Like I'm thinking now, I'm like, oh, I didn't even think that far into it. But I'm like, all of these are strategic things that they're marketing for money, but they're not thinking about the health of the child, right?
Right.
Yeah.
And they think for the child, they for some reason kids all have access to some means of money, right? Through parents, through allowance, or some they're do not estimate them. They're so creative. Even though you think, oh my God, marijuana is like, you're not supposed to be able to get it, but they're so creative that they have ways of getting access.
No, they really are creative. I have seen creative ways that kids get some things. I can't even.
They want it, they will get it through their
They
peers and
Yeah.
even through their parents. And again, as we mentioned earlier, oh, it's legal, must be healthy. And they see it in their parents. They see their parents' stash. They know where the parents' stash are.
Yeah. Absolutely. This is a moment where we can either do a mini crash course or we can close the segment and talk about your projects that are going on and all of those things. So,
Well, I mean, in terms of crash course, I think it's important for us, health workers in this field, and including parents, number one, to be aware and acknowledge that this problem exists. It is here. And sometimes we negate, oh, they're only 10 years old, they're only 11 years old. Unfortunately, what I'm seeing is that it comes even younger. So acknowledging it, knowing it, and even screening, and as I mentioned earlier, those screening tools are scientific based and easy to do. Start that conversation in a very non judgmental way and confidentiality as well. That's important. Now, being able to recognize that, now what? Be able to know access of care. And sometimes what is important is what we can do about that, educating our policymakers, our legislators who makes these laws and help them realize it is a developing brain, even at the age of 21, 25 years old, and the consequences that can happen. And there are ways that we can do so that it's a harm's way from them. Now, in terms of research, I'm very excited about this. As we know, so there's two research that I'm very involved with. As we know, research shows that cannabis use during adolescence is associated with accelerated thinning of the prefrontal cortex, which affects executive function such as planning and decision making. So the projects that I'm involved right now is that can you reverse this? Studies are investigating whether brain changes induced by cannabis during adolescence is this reversible? So that's very, very exciting.
Yeah.
The other thing is, as I mentioned about my passion in advocacy. So regarding Colorado, we were seeing the importance of how policy impacts. So researchers are now examining the impact of varying different state level cannabis policy on youth mental health to help create better preventive strategy. So we're all looking at different states and what are they doing about this? Do they even know? What are they putting in the laws and regulations? And then what's the outcome of that? Are they seeing less adolescents visiting the emergency room, right? For example, suicidality or even acute psychosis. So those are the two exciting research that I'm involved in and really, really want to know and be able to report back to you and your audience here.
No, absolutely. And we are always happy to have you back. Like, just please let me know. Whenever you want to come back, please let me know. And when you talk about the research you're doing, the advocacy, it brings me to through all this things that I'm doing and learning, have put together a foundation, and it's focused on education, awareness, and advocacy and research in mental health, psychiatric, and addiction care. And it's really focused on youth and trying to empower youth, but also build campaigns through them and access the outcomes of that. So, if you ever want to be a part of this and like the new initiatives targeting cannabis use, all of that, I am always open. And you probably know a few of the people that are on the board. We are always open to all of these campaigns and ideas and interventions. If you have any youth that may be interested, please send them our way.
Oh, this is music to my ears. I love this. Yeah. Please tell me more about the foundation. And
I definitely. So it's called Rafa Foundation. It came to be sometime last year. And through my medical training, I do a lot of research. I received, in 2024, had received a SAMHSA award to look into some things. And like I said, I do a lot of access gaps, disparity oriented research. So through that, I started doing a lot more harm reduction in pregnant women, all of that. And then a lot of what I would find would trace back to just social determinants of health, social determinants of mental health. And even as of 2 days ago, I'm like, social determinants of addiction, because there's so many nuance and complexity to all of these things. So last year, we actually are presenting this at APA. This year, I took a look at a 20-year span of SAMHSA data on substance use and age of first onset, and the different social determinants, the bidirectionality of it, and all of that. And based on that results, that's how the Rafa Foundation, the idea, the initiatives came about. So the first initiative that we actually currently have and are recruiting for pilot, it's called the FIRE Initiative, and it's faith and resilience, because through the research, we found that faith settings are a place that a lot of people were using and going to, especially minoritized and marginalized populations. So the idea is to use those settings to, one, educate the clergy, build referral hubs and connections to resources, and try to at least reduce the stigma, but also prepare them for crisis interventions and appropriate tools that they could send people to the right places. So We are going through all of the legal process to set up the actual foundation, do all of that, while pushing all of these things out. So
while having a life at the same time. Wow, that's so exciting. I mean, that's a lot of work, but sounds so rewarding. What you're doing and amazing.
thank
Yes,
you.
definitely. Yeah, if you want me to help spread the word and be part of this is music to my ears. Definitely, and I can bring people to you as well. So yeah, very exciting.
No, absolutely. I am so excited. I love this. I will definitely rope you in. Right now, we set it up, but we have to legally iron things out. So I just, after months of meetings and meeting lawyers and all of this, we have that underway. So once we have that, I will be talking a little bit. There's a second presentation at APA talking a little bit about the FIRE initiative itself, but there's other initiatives, like I said, just the social media campaigns and all of that, trying to build social media. So this podcast is also one of those initiatives, but this was through NIDA. So that was a NIDA award that birthed this whole thing. We're very hopeful and continue to do this. And it comes down to the passion because on a Saturday, the weekend that I have off, here I am. So having a life is not really part of the equation right now, but it's rewarded and it makes me excited to be able to be a part of people's stories and the privilege that they allow us to be a part of that.
And this is why we do this, right? This is why we do this type of work. It really helps not just our patients, our profession, also ourselves, that we are making a difference. So exciting. I'm so happy for you. And yeah, I could rope me in, I could bring people in, and you could definitely come in. Anything I could do to help. This is music to my ears.
Thank you so much. I really appreciate you. And do you have anything else to add before we close out?
Now, I think the thing is, our audience needs to understand the importance of our voice. Let's continue to raise our voice and make it heard in our elected legislators, right? So we are the one who elects them and we can make a difference.
Absolutely. And one of my mantras is speak up, be heard, and give back.
There you go.
I live by those three. So
Love it.
for our clinicians that are listening, just know that adolescent cannabis use is associated with an increased odd of, later depression and suicidality, whether it is an attempt or just the thought of it. So screening and early intervention is very vital, as Dr. Vito has taught us throughout today's episode. If you're a trainee listening, a medical student, an allied professional, whatever category that you fall into in our health profession, just know that relative risk must be interpreted within developmental and systemic context because there's all these multifactorial risks that comes with what we do, and you have to be one, very knowledgeable in what you're doing, but also ready to learn, right? Because that's why we're here. We're lifelong learners. So
Exactly.
always learn. If you're a policymaker, we put you in the positions that you're in for a reason because we trust in you that you will do what's best for us as a society, as a community. So please integrate youth prevention frameworks when you are thinking about legalization and commercialization. Think about prevention, think about the health outcomes and what you can do to make that the best for our youth. And for the general public, we said this over and over again. Legal does not mean safe automatically. It does not mean risk free. Just because it's legal does not mean it's risk free.
And it's not healthy either.
Yeah.
Either.
There's always some form of consequence that comes with that. Even if it's just water that you're drinking. And in adults,
Or cannabis from a plant.
yes. yes. And in our adolescents, you have to think about their developing brain. Even at 25, their brain is still developing. And putting in substances that can change that neurobiological chemical structure of it can be very significant, lifelong significance. So please, 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 please. And I am, as always, so grateful to our guest, Dr. Vito. So amazing. This has been so rewarding to be a part of it, to be here, listen to you. So thank you so much for coming to do this.
Thank you so much for having me. Really, it's been a pleasure and so much fun, to have these conversations. It's really, even though post call. So I'm totally wired up now and I could just keep going. But it really is, it's a privilege to be here with you to discuss this important topic.
Thank you so much. And to our audience, as always, thank you for listening. Stay ready, stay aware, stay grounded, and I will see you same place, same time, every second and fourth Tuesday of the month. Thank you.